So first question, imagine you walk into the doctor's office, right? What is the first question they're gonna ask you? Someone unmute or type in the chat, or one of the first questions. Or if you're a physician and you walk into a patient's room, what is the first question you wanna ask them? Nobody? What is wrong? Yes, exactly. Nice, Arnav. Yeah, right? Why are you here today? Why do you need to see a doctor? What's going on, right? That is always going to be the first question that kind of comes into play when a patient walks in. And maybe you've experienced this when you go maybe to the pediatrician or to any other specialist that you might have gone to. Why are you here? And so when it comes down to it, there's a lot that goes into when you walk into a doctor's office, from the moment you walk in to the moment you walk out. What is a physician trying to do? Let's say you're a new patient, and for the sake of everything we're doing today, let's say you're a new patient and you haven't been diagnosed with a condition. You just know you're in pain. Maybe you have pain here, you have pain there. You have some other thing that's causing you discomfort. And so you want to know why. What is wrong? Why can't I? Why is my vision blurry? Why can't I walk straight? You know, there are a lot of issues that come into play. And so I think, very traditionally, we always talk about this idea that a physician is there to a physician, a PA, diagnose, but then with the entire arsenal of healthcare professionals to treat. But the first step comes with making that diagnosis, as you all, I'm sure, have seen in your own experiences. And so what is involved in creating a diagnosis? It is very complex, and that's what I was trying to emphasize with the multitude of questions that come after that first, why are you here today? And so it requires a lot of critical thinking to match what you know from what you learned in medical school and what you know about healthcare to the patient that's sitting in front of you. Because nothing matches perfectly. It's not math where things all add up, right? And all the equations work out. And so this is where it comes into a skill of being able to understand both the raw medicine, but then also being able to connect that to a patient. And I think, that's kind of what defines healthcare. And that's why, I'm really excited for this meeting. And I hope you guys can appreciate that. So the first half of this is going to be a little bit slower and less interactive, but the second half is going to be the really interactive part where you guys get to actually, go in that, put yourself in those shoes and really try to figure out, based on what you know about a patient, what the diagnosis could be. And then you can even further think about treatment. So I'm going to screen share here. Give me 1 second. So today we're talking about GI, and maybe you have nothing about GI, maybe you know everything about GI, in gastroenterology, right, which is your digestive tract, to put it quite simply. And so when I say we're going to do a series about this, it comes down to this fundamental part of medicine, which is understanding a patient and connecting it to symptoms and pathology, the disease that you would eventually propose as a diagnosis. Obviously, it applies to every single profession, right? And so we're going to start today with GI, specifically because it's going to be a perfect lead-in to our healthcare professional who's coming in next week, who's a gastroenterologist, and that'll be next Tuesday. And so ultimately, we'll end up going through multiple specialties. So don't worry if you don't really grasp or really appreciate or don't enjoy this particular specialty, because what it's really going to come down to is your ability to make connections and this critical thinking level that a physician, that's so important to being a physician, to being a PA, to being a nurse, to being anything in healthcare. Okay, so GI, right? the digestive tract, I think we've, been ingrained with this, the basic understanding of what the digestive tract is in like elementary school, middle school. And so I have a little diagram here, but really what I want everyone to focus on is the main organs at play. Because when we think about diseases, right, it's very helpful to think about what particular organ is being affected. And so the main organs that we're going to look at really are, well, you have your mouth, right? But then esophagus, very important part that'll come in today, your stomach, and then all the organs kind of around your stomach that are involved in producing everything that's necessary for digestion, your liver, your gallbladder, and your pancreas. Okay. And then large intestine, small intestine, large intestine, right? And so I think GI is one of those things that's sometimes kind of obscure. Not everyone knows about, how it works, but think about, what are the what can you measure? Can someone give an idea of like, what is a symptom of any GI condition? What do you think would happen if you had something wrong with somewhere? Well, what would a symptom be that could happen, that could occur with GI, considering what it is and what are the organs involved? Someone go ahead and unmute and give me an idea.
Stomach pains would be one.
Right, exactly. Stomach pain. And I think, tell me, has everyone had stomach pain at some point in time? It's, definitively inevitable. But by all means, I think, we think about a headache, you get stomach pains, always very common. Obviously GI, yes, stomach pains. But when you say, I have stomach pain, what does that actually mean? Look at the diagram. I mean, look at how many organs we have in this region. It's not always as clear cut to know exactly where it is. And that's where it comes down to, all these different organs, or you would learn, and we'll talk about this, learning all these different organs, and then breaking down based on what a patient tells you, where is the pain actually coming from? It could be the stomach, right? But it could be the pancreas, could be the liver. And there is a differentiation when you have the patient in front of you in the patient's body. Okay, so before I go into the details, we're gonna basically imagine like a super quick medical school. Let's say we're reading Grey's Anatomy, like the book, not the show. But that's what we're gonna go into. But first, MedIzzy is an app that I want everyone to download because there is going to be a little bit of time where after we finish this presentation and go into the actual interactive aspect where you might be waiting a couple minutes as other students finish up questions. So go ahead and download this app. I'll give about a minute. Just click download. Don't need to log in. Don't need to open the app. But on your phone or your iPad, go ahead and pop that open. And I'm going to read the chat 1 second. Yes, for the students who responded in the chat about the GI conditions, yes, definitely. That's very good. Acid reflux, nausea, vomiting, loss of appetite. I think we very commonly hear those words all together, right? And so, yes, very good. Okay. So I'm gonna move on. If you haven't, just go ahead and click the button. When we think about making a diagnosis, like I said, there's a lot involved. Give me something. So we ask the patient what their main concern is. What's another question we should ask them? What do we need to know about them to make a diagnosis? It can be broad, but go ahead. I mean, answer.
Patient history and like familiar genes, I guess.
Yeah, patient history, extremely important. And that comes down to something that we'll talk about, which in part is part of what we call etiology, which is how did this disease process occur? What is the origin here? And so understanding family history is huge. Got to understand what genes could be involved in a predisposition to certain diseases. And I think maybe some of the ones that you've looked over in the slide set beforehand have that exact thing. And we'll talk about that. All right, give me something else. What else would you ask a patient other than family history? And then obviously chief complaint is what we call when they first come in and say what's wrong. What else would you ask them?
Like lifestyle, like alcohol, drugs, physical activity, diet.
Yes, that's very good. And that's very involved in a lot of different pathologies that we'll talk about. And we, for the sake of this, for the sake of today, are going to call that social history. which is everything that you're involved in. So in today, right? Like you said, diet, exercise, very important. And so there's some more things that we'll go into as we get to the actual case studies, which for those of you who aren't familiar with that term, a case study is basically what we're calling, here is our patient that came to us. Here's what we know about that patient. And that is our case study, and then we make the diagnosis. Okay. So does anyone have anything else to add? What else would you ask a patient or want to know from a patient? Sorry, I don't have chat open, but I see yes, history for sure. Think about when a physician walks in, what do they have on them that might be something that can give you a hint to what you want to know about a patient, right?
The medical history.
Yes, medical history is definitely a part. Yes, definitely. Good. And that's one of the things you're going to see on the case studies as well. There'll be a section for that medical history. So what, maybe it's what, sometimes this is a differentiation between their surgical history, right? Where you have what surgeries have they taken, but also what previous conditions do they have? A lot of conditions, and you'll see this especially, maybe maybe your grandparents, right? Or someone who's older often have what we call comorbidities, which is there are multiple diseases occurring at the same time. Maybe you get diagnosed with one disease 17 years ago, and then 5 years ago you get diagnosed with another disease, and then now you have this new potential diagnosis, right, for another disease. And so they're all interacting with each other. They're all occurring in your body at the same time. And to know the medical history is super crucial to understanding what's going on with the patient and eventually make a diagnosis. Exactly. Okay. So one more thing I kind of want you guys to think about. When I take my stethoscope in, right? Imagine, right? You can walk in with a stethoscope. What information is that we generally refer to? You have your blood pressure cuff, you have your stethoscope, you have, you know what I'm kind of getting at. And so what would you call that grouping of signs that you would take from a patient?
Vitals.
Correct. Exactly. And vitals are a very key thing, even though it might seem kind of simple and on the surface level, it's a crucial part of understanding the patient. And it's something that is very important to get to. And I see that in the chat too. You all sent me that. So awesome. Awesome. Okay. So now we'll get into it. I'm going to go over a number of different diseases. I'm going to go over it briefly. If you guys want to look at it in more depth, you have the slides in front of you, and you can use the slides when we get to the kind of more interactive case study part. But basically, right, I think most people are familiar with the idea of what a cancer is, right? And a gastric cancer would be a cancer in the lining of the stomach, right? Which makes sense considering gastric refers to the stomach. Okay. Etiology is very important here. Age and diet, that is your social history, right? And so I don't want to read everything on this slide because that's a lot of time. But what I want you to note is that a lot of these different conditions that we'll talk about, and maybe you'll see it on the slides as you have it open, a lot of them have some very similar symptoms, right? And I know a lot of the ones you mentioned, like, okay, stomach pain, nausea, vomiting. I mean, these are prevalent across multiple conditions. And if you just have that information about a patient, can you make a diagnosis? It's kind of rhetorical. Yeah, it's very difficult to make a diagnosis with these kind of broad-based points. And so what I want you to really, really pay attention to is the etiology, which differs significantly between these different conditions, and also the very stark signs and symptoms that define one disease versus another. For example, blood in the stool. That's common for maybe half the diseases that are on this list. But something like jaundice is not as common across all the diseases. And I think, when we think about medicine, right, that's kind of what makes, that's why we have so many years that go into medical training, no matter what healthcare profession you go into. There are so many different aspects that must be understood in the context of a patient, because you need to remember that like that when you think about, okay, what conditions could this patient possibly have? So I think a lot of these are actually this gastric cancer, these first symptoms in the early stages are what we consider maybe very common among the GI conditions. And I think our GI specialist next week will very much be able to talk about this. But if you read those and you think, oh, well, those are, I mean, that's very, you'll see that they reoccur throughout our next couple conditions. Okay, so I'm gonna go, and I don't want to read every single thing in detail, like I said. So here's another thing, esophageal varices. Okay, and varices just means, well, I say just, but it's a condition that can occur basically anywhere in the body where you have a highly venous area, right? So where you have a lot of veins, and so this is enlarged veins. Basically, what I want you guys to notice is that, okay, we're grouping with the GI conditions, right? It's part of the GI conditions, and the symptoms are extremely different. Right? There is nothing quite like this vomiting large amounts of blood that you would get from a gastric cancer, right? That was not in the original, in the previous slide. And so keep note of these very big things. So vomiting large amounts of blood, very important. Notice that they don't always bleed. And so that means, you know, that you have maybe early on, you might have the varices, but they won't, they won't manifest symptoms until you see these conditions like lightheadedness and vomiting large amounts of blood and something as severe as loss of consciousness, right? Okay. So again, right, acute pancreatitis, pain in my stomach, what do I do? But what you'll notice is that there's a difference here. It penetrates to the back in 50% of people, which is a good margin for the basis of understanding conditions, right? So if you just say stomach pain, it's very hard to differentiate. But now we see pain in the back and the etiology, very important. Gallstones and alcohol abuse. And what you'll actually notice is that there's a difference based on the origin. You have a different kind of symptom duration. You see, right, when it's caused by alcohol, the pain develops over a few days. But when it's caused by gallstones, right, it starts suddenly and it's minutes. And so these are the kind of things that I want you to be looking at as we go through this. And I'm going to start going a little bit faster, but really be aware of these really important distinctions. And you can read a little bit more about it. There's a source at the bottom left as well. Okay, hepatitis. Maybe everyone, I hope everyone's kind of like heard of hepatitis to some degree. But what causes hepatitis? Think about, you read here that here are the hepatitis viruses that cause it, but think about where could a patient get hepatitis virus from, right? It's not like COVID. It's not like our coronavirus. It's not spread via just breathing. And so keep these in mind when you think about where could a patient have got this from? And that's where it comes into this social history. Where have the interactions been? Where could possibly this virus have come from? And so that's what you'll think about as you look at these. And then also it tells you really where is the pain? And you'll notice this is a very important thing. And I think maybe if you've ever had maybe stomach pain, maybe you go to the physician and they say, please point exactly at where your pain is. And so when you see something like this on one of these symptoms, signs and symptoms slides, note that, because the location of pain is very clear correlation to where the organ is, right? Because these organs are, well, they seem close in our diagram. On the actual patient, there's a clear distinction. Okay. So an inflammatory bowel disease, I'm gonna kind of skip over this slide kind of briefly. You can read it really quickly. I'll probably do 30 seconds now, and I won't read them all in detail. So we can get to the next part. And you'll notice that the etiology isn't always something known. And so maybe that's not something you want to look for. If you don't see anything significant in the etiology, then maybe don't be so promised on the condition that you might think it would be, the diagnosis that it might be. Crohn's disease, very common to hear that word, I think. Again, something that's not known. But you'll notice all these symptoms that have to kind of come together to some degree. And I think if you remember, we did the DSM-5 with the psychological condition diagnoses, the psychiatric conditions diagnoses. And you'll notice that, we said that you need to meet 5 of the criteria and then you have the disease. Okay, not exactly. There were some criteria and conditions that changed that. But when you're approaching something that's not via DSM-5, there's a lot more of nuance that comes into play of understanding the etiology and the signs and symptoms. Okay, so here, etiology, very important. I want you to look at that and note that. Very, very important. Okay, sorry, I let someone into the room. Okay, good. I'm going to keep going. GERD. I know someone mentioned that. We think of acid reflux, heartburn. Very commonly, we refer to this. It's a very common condition. You might not be diagnosed with it, right? Necessarily, if it's very mild. I think often, I'm sure you've maybe experienced heartburn at some point. That feeling, right? But that doesn't necessarily mean you'd go to a doctor and they say, oh, you have GERD, and this is problematic. And that's the level of severity that comes into play as you kind of look through these symptoms and how you can imagine how some can be much more severe and some are less severe. Okay, and you can keep this up when you guys go through this. So here is very important abbreviations that I want everyone to kind of take note of. I'm going to keep this up, these abbreviations up when you guys actually do the case studies, which is just this last slide. But very important. I want to read these because they're crucial to understand. HPI, history of present illness. On the first case study, you'll see all these breakdowns. But first of all, history of present illness, patient medical history, family history, social history, what medications they're currently taking. You have some allergies, whatever. Review of symptoms, extremely important. I want everyone to be sure they look at the review of symptoms. And so all these cases, they're not all the same. They don't all have all of these. And so really focus on the information that's given to you, and it's not going to be every single one of these. So just keep that in mind. The information that's given to you should be sufficient to make a reasonable guess about the diagnosis. And I don't like to say guess because you really shouldn't guess diagnoses. But you know what I'm saying. So you have the physical examination and vital signs, last ones. You guys did a really good job of really hitting the most important ones. And often you'll also see chief complaint, which is, I know what Arnav said at the beginning, that chief complaint is, why am I here originally? Okay, and you can read some of the other ones, but I want everyone to look at distension, just because you'll see that in a couple of them, which is the bloating or the enlargement of abdomen, often due to fluid buildup, just so you know what that word means. And then HX means history. They like to put X's at the end of things to make them short. Just a thing. Okay, so now I'm going to open Socrative, which, if everyone can go to the join or search join Socrative, I forget the exact thing, but I'm sure you've all used Socrative before, maybe. But just Google join Socrative, and Dan, can you actually find that specific link that join Socrative? And then I'm going to start this. Here, I'll send it in the chat. Give me 1 second. Socrative, join. Okay, sorry about that. So it's in the chat right now. You can go ahead and I'm gonna give you the room name in just a second. Why is it? Okay. So it's, all right, so it's R-A-Y, I don't know, that's my last name, but there you go, Ray 6209. Sorry, 009, 6209. Does everyone see that? I hope. just let me know if you have any trouble getting in. I just want to make sure this works. It's the first time I've been using this. Okay, I see 14 people are in. That's a good sign. So you can pull up the list of that's slideshow, so you have a reference if you want, or you can challenge yourself and try to do it without the slide set in front of you. But I'm going to start that in just a moment. Give it 30 more seconds. If you're not in, let me know if you can't get in or have any difficulties. The code again is RAY6209. And that link is in the chat to that Socrative login. Okay, can someone tell me if you can see that first question? Yes? Yes, okay, awesome, awesome. All right, so we're gonna go give time. I'm going to screen share and put up those abbreviations so you can see them. You probably won't need them for the first question, but you'll have them in front of you. And we'll do 5 minutes or we'll do 3 minutes. Go ahead and read through it. And based on what we just kind of talked about and what you try to figure out and take a guess and see what your diagnosis as doctors would be. So go for it, and we'll do 3 minutes, and I'll count that. And you can unmute if you have questions or just want to learn something new. If you have any questions about the particular order or anything like that or content. And so my hope is if you finish answering the question, it won't let you go on to the next one. So suggest using that Medizzy and see what you can figure out, log in or make an account, it's free. And just play around. Sorry for interrupting. So about 30 seconds to wrap up, I think. All right. Let's see how you did. Again, first time using this Socrative thing. Let's see. Look at that. You guys are pretty good. 81%. I'm impressed. I'm impressed. Um, I wonder how many of you use the slide set though as a cheat sheet. That's great. So could someone tell me, what were the giveaways? Yes, alcohol. I got in the chat. Definitely, definitely. And one of the things is there's a specific correlation. Does anyone remember with the duration and the alcohol? You're all answering right, but you don't have an answer for me? Yes, lasts over a few days, exactly, in the chat. Very nice. Okay, so in addition to the alcohol, right, what was the one giveaway that makes it not just normal abdominal pain that we might consider with a stomach ache? Right, the pain wasn't just in the stomach. Yes, back pain in the chat, exactly. Okay. Good. So that's where it comes down to not as straightforward. And one of the things, did anyone catch the position that the patient was sitting in? One of these subtle things that you might not always pick up because you're looking for symptoms and etiology is that the patient was sitting hunched forward, right? They were bent forward. And one of the things about acute pancreatitis is that relieves the pain for the patient. And so it's these subtleties that really are important to notice as a physician. And I think it's something we often overlook. We think about, oh, there's a lab test and the blood tests and we have the vital signs and we have all these really mechanical ways to approach it. But also when you walk into the room and seeing the patient hunched forward. Okay, so we're gonna go to the next question and I'm gonna hope that this works. Can everyone see the second question? Give me a yes in the chat okay, perfect. Thank you. All right, so we'll do 2 minutes here. I'm so bad at screen sharing. So here also, because I know the abbreviations are no longer on there, you can see it on my screen now. Sorry about that, I forgot. Okay, we'll do another 15 seconds. Just kidding. There aren't many responses. Maybe we'll do another minute. Sorry. or right? So I got 10 out of 17. We'll go ahead and let me refresh. I don't know. All right, so 50% right, Crohn's disease, yes. Oh, numbers are changing too. 58% are right with Crohn's disease. Yes, that's very good. Okay, so can someone kind of explain why Crohn's disease as opposed to, I think, peptic ulcer disease and ulcerative colitis were both very close. What is it that kind of pushed you one way or another? The children were healthy. That's a very good point. Yes. That's a very good point. Anything else? Yes, there were no ulcers and sores, right? The symptoms definitely aligned. No drug and alcohol use, yes. And I think that's also an interesting one to take note of, right? When you're talking about, you know, we multiple choice, right? You process of elimination. Obviously, it's kind of weird to think about that in this context because there are thousands, hundreds of thousands, you know, thousands of diseases that we could pick from. I also see her depression, yes, definitely. And one thing to keep in mind is this. The use of alcohol in this specific context is one that can actually help you knock out options, right? And so to know a negative, right? We often think, oh, is that a positive symptom? A positive symptom, like it's, you know, a present symptom. That's going to give you the diagnosis. But you also want to keep in mind those negative symptoms and what defines that. And so one thing before we go to the next question is right now you're being given, you know, the information in front of you. And so that's the skill of taking information and putting it into a diagnosis, correlating it with the question that you have in front of you. And what, you know, when it comes to getting that information, that's where the question taking comes in. So, you know, that's going to be another thing that we're going to try to go into with, like I said, I'm kind of calling it a series because it's related and about this clinical interpretation and understanding from the perspective of the patient's room, right? But I think one thing that we're going to do as well is also look into this. How am I getting this personal medical history? How am I getting, you know, the allergies? I don't know if that was on this question. How am I getting the family history, the social history? And so that's going to be something we'll also go into. So I'm going to go to the next question. Okay. Next. Okay, I hope that worked. And then I'm going to pull up that abbreviation sheet and go for it. We'll do 4 minutes. So go ahead. Okay, I think we're gonna go just a little bit quicker, just because I know I don't like to go too much over the 45-minute mark. So go ahead and pop your answer in. This one's a little bit shorter too, so hopefully that helped a little bit in terms of the content given. All right. Yes. So esophageal varices. Yes. And I think, this is very good. You guys did a good job. The big difference is that this is significantly distinct from a lot of the other conditions where you have that stomach pain, because they gave you, what was the main thing that really was like for sure, or almost for sure, that it's a symptom of these varices? Yes. GI bleeding, vomiting large amounts of blood, definitely, and then loss of consciousness with the bleeding. And those two together push it away from a lot of the other options that we've talked about with the GI conditions. So very good. Okay, so I'm going to pop over to the next one. Oh, also, one thing I want to mention is that something that you might not always catch at the first time is that alcohol use, which you may have not known this, but causes extended alcohol abuse causes scar tissue to develop in the liver, which we call cirrhosis. And so that's one of the other reasons that you can make that correlation, because that's one of the points of etiology with these varices. Okay, so I didn't click next yet. Here's another one. It's a little bit shorter, so we'll do another 2 minutes, 2.5 minutes. All right, another 30 seconds to just finish up, put in an answer. All right, how did we do? Okay, as far as there were 2 answers. It was relatively close, but gastric cancer won there. Oh, 3 answers, I lied. And so yes, gastric cancer is the correct answer. So I'm gonna ask again, what are those indicators that make it specific to gastric cancer, that you made that decision? Heartburn, yes. Yes, and heartburn is actually an interesting one, because that's a comorbidity with it mentioned the GERD, which is one of the other conditions we talked about, smoking. Yes, yes. I think the biggest thing, and I know I keep asking the same question, right? What is it that made you thought that? I think this was the diagnosis, but this is a skill that's not easy to put together. And it might seem nice when you have the the medical school textbook in front of you, right, with these with the slides there, but being able to really take the most important pieces from all of this information is really difficult to do, and it might not feel like it, right, but it's great that you guys are able to kind of pull these crucial parts from the whole case that's given to you. Okay, I'm gonna go to the next question here. Okay, we'll do another 2 minutes, 2.5 minutes. All right, go ahead and pop in a response there. Isn't it so frustrating that it gets dark so early? Like, I feel like we've been sitting here for 4 hours because it was light and now it's dark. Okay, let's see. I'm gonna refresh one more time. How'd everyone do? Wow, 100%. Look at that. Good work, guys. Yeah, exactly. And I think this is one of those things that it's very distinct from the other conditions, right? And that's what makes it clear. Yeah, very clear. So I'm gonna challenge you. There are 2 more questions left, and then we're done for today. Try not to look at your slide sheet. Try to just kind of go at it with your memory and try to respond to the question and see if you can get it right. This one's short too. It's just the history of present illness. All right, just a few more seconds here. All right, in 10 more seconds and I'll. Does it tell you if you got the correct answer or the incorrect answer? I'm just curious. Give me a yes in the chat or unmute. No, it doesn't. Okay. Well, that's good to know. So I'm not being too redundant. Okay. How did everyone do? Peptic ulcer disease. That is the correct answer. Yes. I'm surprised no one picked ulcerative colitis. I feel like you often they're kind of similar in the symptoms. But yes. Okay. Good. If you did that without looking, good Good job. Great job. If you did it with looking, still good job. So I think, what was the one thing I think that really was one of the most important things in reading this and analyzing it that set it apart from the other cases that we looked at? Nobody? Yes, use of the NSAIDs. Yes, the ibuprofen and the aspirin, which are both NSAIDs. Yes, and then I think one other thing to note, and this is kind of general, but high stress is going to aggravate a lot of conditions. Obviously, that's not directly related to the diagnosis, but yes, notice those. Something that you might not always think is the first thing to ask is how much ibuprofen or how often have you been taking aspirin, but that's part of the medical history, and I know someone brought that up at the beginning. Okay, so last question. Try to not look at your sheet at the slide set. All right, we'll do another 30 seconds. All right, so finalize your answer if you have not done so already. Okay, yes, viral hepatitis. Very good. So I think, one of the most important things to note is, where could he have possibly gotten this viral hepatitis from if he, has never had, unprotected sex, right? Or anyone diagnosed with viral hepatitis? Someone tell me, let me know. There's a small detail in there that defines that difference between just seeing that, oh, he's never interacted with anyone who has had viral hepatitis in that way. Anyone? Where did he get it from? Or theoretically, I might add. I don't know if you can scroll back up. He got remarried. Yes. The one thing is that I want to remind everyone that that could be a way. But the one thing is that it told you that he hadn't interacted with someone who had viral hepatitis, right? And so there's one detail in there. I want to see if you guys can get it. It's a very small thing, but it's important to note think about the different ways that a disease like that can be spread, right? What are the bodily fluids that can be spread within? IV drug use, right? There you go. And so, yes, and I think it's easy to overlook, right? Imagine if you were sitting there in the room with this patient and he's like, I've never, had any sexual relationships with anyone who has viral hepatitis. You say, okay, let's rule it out. It's not part of the question. Well, would you take the time to ask if he's ever used IV drugs? And so that's one of those really key details that I think, is often the critical thinking aspect to pull together other than just our symptoms, which is of course very important by all means. But thinking about that and really, taking a holistic understanding of what is going on with this patient, where could these disease could have come from. Obviously this is specific to a virus, but in general, when we talk about etiology, it's very good that you analyze that and make sure you notice everything. Okay, so that kind of concludes the case studies for today. And I know it was very focused on GI, and I think it was quite long. So I apologize. I think our next one's going to be less than an hour. It was a bit longer today. So thank you. I hope you guys enjoyed, learned something. If you have any questions, hang around after. Let me know. And I think free to go. Also, definitely come next Tuesday. You gotta flex your GI knowledge now on our gastroenterologist who's coming in on Tuesday. And that's in Schoology. You'll see that next week with the update too. But definitely come next Tuesday, and that'll be. I think you'll find it more interesting when you know a little bit more about the conditions that are involved. And so I hope you find that exciting. Kind of hope. The hope is that. So see you guys later. Have a nice evening, and remember, HOSA is optional for those of you who are in HOSA. I just want to always have a reminder there, unless I emailed you otherwise. Okay, bye everyone. Stick around if you have questions again.